Welcome to Dialogue with Deidre. I'm your host, Deidre Malone. I am so happy that you're following us on the Carter Malone Network. If you have not subscribed to our YouTube channel, please do, and then follow us on our social media platforms. So excited to have a good friend of mine in the studio today, Thurston Smith. He has a whole lot of letters behind his name. Thurston, Associate Professor of Psychology and Physiology?
Sociology.
Yeah. Graceland University. Associate Minister, I'm really excited about this, want to talk about it, at New Salem Missionary Baptist Church. And you're a divinity student too?
I'm working on my doctorate in ministry at Memphis Theological Seminary, as if I don't
have enough to do.
Yeah, and you know, it's interesting that you asked that. It's in an area that's near and dear to your heart. The title of my doctoral studies project is Establishing a Faith-Oriented Approach to Address Juvenile Crime and Improve Student Academic Retention in Memphis and Shelby County.
I love it.
Yeah,
what made you decide, Thurston, and we're going to talk about a few other things, but what made you decide to make that your topic for?
Well, were you not? Well, listen, first and foremost, I would be remiss. Thank you so much for having me. And as an FYI, in case you don't remember, the last time you had me on your show was 10 years ago, January 11th, 2014.
Stop it!
Yes, ma'am. Yeah, you can Google that.
Okay.
January 11th, 2014 was the last, and the topic then was juvenile justice. And you were one of the Shelby County commissioners that appointed me. You and Steve Mulroy and Melvin Burgess appointed me and Henry Brooks to the Shelby County Juvenile Justice Consortium.
I remember that.
With the recommendation of Mayor Mark Luttrell.
I remember that.
Ma'am. Yes, ma'am.
Oh, my goodness.
Yeah, and that's why. That answers your question.
That does answer
That's
my
why
question.
That's the title of. I've been committed to working with our youth since I've been in Memphis, which has been 16 years.
Well, you've been doing the work, though.
Yeah.
And I guess that's the reason we definitely, and then I knew you, and I thought you would be good, so that's the reason I know I voted for you.
Thank you.
Okay?
You're too kind.
So let's talk about, I'm just so glad that you reached out when you were presenting as a part of Oakton College earlier this week. I didn't get a chance to sit in on the presentation, but you were delivering a seminar, Improving Access to the Care Within Communities of Color. Right. You know that there have been so many, we've been disenfranchised when it comes to health care, and it started way, way back.
That's correct.
You know, when I think about the Tuskegee Institute and what happened with the gentleman when it came to research.
Correct.
So it's a part of our history. Talk to me about how we need to be improving our access to health care.
Well, so interesting because when the professor of human services introduced me before I spoke at the seminar yesterday, I gave a little background and history on why I'm involved in this topic now, and so I'll do the same here. Back in, I believe it was 2020 or either 2021, which was in the heart of COVID-19.
Yes.
The University of Alabama, who I've been an invited speaker multiple times at their university, invited me to speak on this topic, or they asked me, was I able to do enough research to deliver, on this topic, and I actually did have an interest in that subject matter. Well, as a result of that went very well, and then Mayor Lee Harris invited me to serve on his mayoral transition team, and then he appointed me over his healthcare access committee.
Oh.
And I need to say this. I was very proud to hear this during the mayor's redress a couple of years ago, that out of all of the committees that he appointed, our committee was at least one committee whose research was so outstanding that he incorporated all of our policy recommendations into Shelby County government. And part of that is directly linked to Region 1 Medical Center. So I'm very proud of this particular work, and obviously the committee that I was a part of.
Let me just say, a lot of people probably don't even know the connection that Regional 1 Healthcare has to Shelby County. I mean,
Right.
the history is, it was at first the, only hospital that treated black people.
Right.
And then now it is truly our public hospital, and Shelby County government is a major supporter of that hospital. So glad
Right.
that Mayor Harris took your committee's recommendations, and have made it and implemented it across the county.
Right. Very important.
Yeah.
Right. And going back to your question about the correlation, or rather the relationship between this particular subject and African Americans, the research, and it's a funny thing because I like writing, right? But it's not like I don't have other responsibilities. And so I don't try not to devote my entire day to writing stuff. But when I began researching in this particular area, Deidre, the data was absolutely overwhelming regarding not just how we got to this point, but why we got here and why we're still here.
So,
like, for example,
okay,
and which is in my presentation, all of the critical legislation, policies in the past, policies that we're trying to undo, as well as policies that we're trying to implement, all involve access to care. The black codes that would access. Plessy versus Ferguson. Here, this man in Louisiana in, I think it was 1862 or somewhere around that time, boards what was then would have been the equivalent of an Amtrak.
Right.
And he wanted to sit with the regular folks. They wasn't having that.
Right.
That case went to the Supreme Court. There were 11 justices, not 12 at the time. 1 voted in favor of him, 10 voted against. And that was the birth of the separate but equal doctrine. Then you had Brown versus the Board of Education.
Right.
Access, which overturned the separate but equal doctrine. Then you have a whole list of other policies, including FDR's New Deal. All of those policies had or are intricately tied to African Americans' access to services, access to this, access to that. Here's the funny thing. While I was drafting the presentation that I put together, I got a little sarcastic, and I asked the audience, out of the list of all of these systems within the United States, which one has the least access to care? The education system, the voting system, the banking system, the healthcare system, and I added the criminal justice system.
And what was the vote?
The only American system within the United States that African Americans don't have any problem accessing is the criminal justice system.
Of course.
Isn't that profound? Yeah. We all know that.
Right.
But when you verbalize it and put it into context, it's really deep.
But Thurston, take it a step further, and you come out of the criminal justice system, right? And that next phase is access to voting.
That's correct.
So it's a double whammy.
Oh,
right?
Absolutely.
You're in jail, you may have committed a crime. In some instances, people have not committed crimes, and they've
still ended up in the system.
Absolutely. You come out, and what should be a human right is the access to the vote.
Right.
But it may take you a minute to get there. You may have to pay and go through a court system in order to get that access back.
Exactly.
Double whammy.
Exactly. Yeah, it's that.
And who does it affect most?
African Americans.
Exactly.
African Americans have the most difficult access to just every social system in the United States.
And healthcare. When you think about disparities in healthcare, I'm married to a doctor, so I have to hear it every day.
Yeah, I can imagine.
Of course, he's not going to violate anything, and he's not going to tell me who.
Right.
But what he is going to tell me is that when he's in the room and he's talking to a patient, and a patient may say, well, I haven't been taking my medicine. And Why not? You need to take care of yourself, right?
Exactly.
But a lot of us don't.
No, we don't.
We don't.
No, we don't. Sometimes we put other things
Before
right?
our own
It's a matter
health.
of priority.
Right. And then if you think about this too, healthcare when it comes to how with the lack of Medicaid expansion.
That's also in
In your presentation?
And there are 12 states.
Okay, let's talk about that.
There are 12 states. And see, this is kind of interesting because the title of my presentation, my seminar, is Advocacy versus Apathy. Mm-hmm. Improving access to care within communities of color. So one of the overarching objectives of my seminar involved inspiring the audience, if they're not advocates, to become advocates.
Wonderful.
And then if they are currently advocates, to become more effective and efficient
in advocating.
And it's a big part of, here's this funny thing. And I'm in ministry. And so I teach psychology. I study psychology. I'm a licensed counselor, so I work in the field of psychology. I also teach sociology. But this is the other thing that fell upon me, Deidre. From a psychological perspective, when we look at all of the challenges that we're dealing with in Memphis, one would say folks are in pain. They've been traumatized. Yeah. And folks lack the skills to problem solve effectively, which is what dysfunction. Dysfunction means that you have a very ineffective or maladaptive coping style or coping strategy. As a sociologist, I say the nature of the culture of Memphis and America, depending upon the issue that we're discussing, people do not understand that folks have different values than theirs.
Right.
And thus they don't know how to interact with people who may have a different approach or a different style. That's problematic. But as a minister, I would quote my pastor and say
Which is a great pastor.
that sin
is
at the foundation of every problem we have. And let me quote Dr. Ray. Sin is responsible for more employment than any other entity. It's responsible for more iron workers, more security companies, more police officers, more trauma physicians, more judges, more prisons, more jails. Sin is the number one employer in the world.
Okay, you're going to have to break that down.
Yeah.
Break it down.
Isn't
That's profound.
Isn't that?
Yeah.
Yeah. Exactly. Huh. We wouldn't have a need for those things if it were not
for sin.
And we need to be clear about that.
Yeah. Emergency room doc.
People don't know how to treat people. And here's the other thing. A great friend of mine who so happens to be in ministry, but he's also a therapist, like he said something one day that I thought it was absolutely profound. And he said, while all affliction is not due to wrongdoing,
right,
all wrongdoing leads to affliction.
Okay.
All wrongdoing. All wrongdoing hurts someone, even the perpetrator, if not only the perpetrator.
Right.
But everybody that's suffering is not suffering because of something that they did.
Right.
Some folks are suffering because of what other folks did.
Now that's true.
Which is why I say Memphis is a city and a community that's in perpetual crisis, constantly, every day of the week, twice on Sunday, every day of the week.
So Thurston,
yes.
When I think about, and let's take a piece of it at a time, like the healthcare piece. When I think about how some of these states won't expand Medicare, right? Medicaid expansion. In a lot of those rural areas, a lot of African Americans still live.
Right. And 3 of the 12 states have the most uninsured and underinsured blacks. You want to know what those 3 states are?
Which states?
Texas, Georgia, and Florida.
Huh. Wow.
And all of the 12 states are in the South.
Yeah. Texas.
And ironically, with Republican-led legislatures.
Yeah.
That refuse the money.
Yeah.
So they proverbial cut the nose off to spite their face.
Right.
They're willing to allow people to suffer to uphold an unmerited ideology.
Right. I mean, because it really does have a negative impact on the citizenry, but it also has a negative impact on the economy.
Oh, absolutely.
If you're sick, you can't work.
Correct.
You can't provide for your family.
Correct.
Hence, here we go with the crime and everything else that's attributed to it.
Exactly.
So, but there's some people in leadership who don't have a problem with that, because that's a part of an economy too, right? Let's go back to that.
Correct.
Locking folk up.
Right. And then establishing private
prison
industry.
Exactly.
And we all know, you don't have to be a rocket scientist, that if you have a private business, then that business has to have a business strategy.
Exactly.
And the business strategy is to make more money.
Right.
And if your product, right, is human capital, then you have to keep the jails full. Then means you have to come up with a strategy to help with that.
Oh, my.
Do you see how sinister?
It is. It is.
This is precisely why I said, as somebody that studies psychology, when I look at problems, I say it's people are in pain, they're traumatized, and people have poor coping skills. From a sociological perspective, I say folks do not understand that within this society we have different people with different backgrounds, different ethnicities, different religious philosophies, different races, etc., and we need to be more accepting of people who we are. And we don't do that well. That's a problem. As a minister, I say the foundation of all of these problems are sin. As someone that's involved in politics and the public policy realm, then I say we need to change policies. But the reality of it is all of that.
So Thurston, the average person may not know how to communicate that. And that's a big part of it.
Right.
That's the reason they elect people to represent them, right?
Yes.
And help change those policies,
right,
at the local, state, and federal levels.
That's right.
Right. So what do we need to do as a part of what from the advocacy versus apathy versus advocacy? Were there some action items that you kind of shared with your audience when you gave them?
Wow, you're going to force me to recollect my entire presentation.
I am.
So when we got...
Because I want my folks to know.
I'll email,
educate our people.
And I'll email you a copy of it as soon as we're done. And so when you're looking at advocacy, one of the top points for my closing remarks, closing recommendations, would encourage the audience to do your research. Constant. And let me tell you, there's a constant amount of research in this work. And in my case, it's to some degree, it's usually overwhelming because I'm either working for a church-based organization, requires research. I'm a consultant for the U.S. Department of Health and Human Services. That requires continuous research. I serve on a number of committees, national and local, in key roles. That requires research. I'm pursuing a doctoral degree, which the entire project is research-based, so everything. So, but it's very important because we're operating now, Deidre, in a climate that is full of both two things.
Yeah.
Disinformation.
Oh, yes.
Which is strategic lies. Let's call that what it is.
Yeah.
And misinformation. Misinformation is normally communicated, did you hear such and such?
Third hand.
But,
yeah,
right,
exactly.
but you don't know if that information is true. So
Right.
often we communicate misinformation in a non-nefarious way.
Yeah.
Just because we're human. But then we also now the climate that we're in this country, very, very dangerous climate, where information is communicated, lies are communicated deliberately and strategically to sway people toward a particular ideology. Now, here's where we get real basic and fundamental. All of us make decisions on a daily basis based upon the information we have at hand.
Right.
All of us make decisions at a moment's notice based upon the information that we have at hand. if the majority of information that we're operating under and through and with on a daily basis is inaccurate information, look at the potential outcome of that. Wars begin over that.
Oh, yeah.
Arguments between a husband and wife.
All day long. Yeah.
Misinformation, disinformation. I thought, you said, I heard, I suspected, without validating. Research is very important in everything that we do. Even Ronald Reagan said, trust but verify.
Right. Got to verify. But I guess the question, though, too, Thurston, is how do you verify? Because some of the sources of the research are inaccurate and plenty of misinformation out there.
And uncredible.
It bogs my mind that people feel like social media platforms are like the law.
Oh, no.
Like that's where you get your news. No. And it's not.
It's not. It's not. In fact, social media is now, I believe, I've heard one researcher, proverbial researcher, mention that social media now is the predominant source for disinformation.
Absolutely.
The counter opposite.
Absolutely. And then you think about somebody who has bought and brought a business here.
Correct.
Who owns one of the major social media platforms. Right. Is the owner of one of the most misinformation-driven social media platforms. Right. He owns it.
Right.
Owns a business here.
Right.
But it's international. It's all around the world.
Correct.
So, but it's not okay.
No,
to have misinformation out there.
No, it's not. And we are now in a climate, operating in a climate, Deidre, where people are comfortable, complacent, and apathetic with the current state of things.
Yeah.
And ironically, though, many folks want things to be improved. Things are not going to improve unless we all, each of us, take our rightful position, assume our responsibility and role in making our community better.
Right.
And sometimes that involves sacrifice. Yeah.
Well, we've got to get out of the apathy mode, though, Thurston. Right. We just do, and transition into the advocacy mode, because that's the only way some of these ills in our community are going to change.
Correct.
Through the advocacy piece.
That's absolutely correct. Well, even Margaret Mead said,
yes,
right? Never doubt that a small, doesn't have to be large. She said, never doubt that a small and a thoughtful, committed group.
That's right.
Can change the world. Indeed, it's the only thing that ever has. And she was a sociologist. I think she was a social worker. Weren't you a social worker?
No.
No, you're not. I thought you were.
Look, I feel like it.
Right.
Because of my advocacy.
Look at the work that you've done. Exactly.
Absolutely.
Yeah, one of the first people that I began following, you and Gail Jones Carson, when I first got to Memphis 16 years ago. That's right.
Oh, my.
And I'm a Memphian. I want you to tell everybody.
The accent doesn't change, right?
That's profound, because we left New York City when I was 18. I'm over 60 years.
Really?
Yeah, and we need to understand that it's innate.
See, I'm from Chicago originally.
Right.
And so, but
Cabrini Green?
My husband, was it Robert Taylor? Robert Taylor Holmes. I grew up in Chatham, which is kind of,
That's a rough, semi-rough name?
No, it wasn't. That one wasn't rough. Yeah. But my husband's, neighborhood was a little rough.
I bet.
Yeah.
I bet.
Mm-hmm.
Yeah.
But my accent now is just very Memphis. Right. And we've been here 30-something years.
Right.
Yeah.
And I haven't lost mine. But
you have not.
But here's the ironic thing. When I go to New York,
what do they say?
My family here is the Southern. No, they do.
They do?
Yeah. That's deep.
Okay, so Thurston, back to the work.
Anyway,
I know.
We went on a tangent.
No, I love it. Yeah. But so talk to me about what else are you going to be working on? Because this is profound.
Well, so there's a national committee that I serve on for my professional association of counselors. It's called the Critical Issues in the Black Community. That committee, and I'm one of its founding members. That committee was established in the wake of the George Floyd murder, and which was brand new for our association. And our association never had a committee that was established exclusively to improving services for African Americans. And part of that work involves access and us sending position papers to members of the U.S. Congressional Black Caucus, those types of things. So I've been involved in all of those different spaces.
That's good.
Here's the interesting thing. I've shared this with many folks. My involvement in politics and public policy was all subsequent to the advocacy work I was involved in the health and human services industry, predominantly the mental health, substance abuse treatment, mental health counseling, substance abuse treatment, and criminal justice space. And since then, I've now had the opportunity to serve in a variety of capacities for a number of organizations.
So we only have 4 minutes left, and I've got a couple of questions I want to ask you, but
sure.
I do want to go back to where we started with the juvenile piece.
Yeah.
What do you think we need to do to turn that around? You know, our juveniles have so many problems and are being locked up. Thurston, what do we need to do to try and turn that around with our youth?
We've heard this time and time again. Great question, but it works. But we can't do it some of the time. We need to do it continuously, and that's mentorship. Okay. Number 2, we need to show them something different. Number 3, and this is a term that we use quite frequently, quite often in the counseling field, we need to meet them where they're at.
I love that.
It's not about and I've even said this during Bible study in church. If you see, and even Apostle Paul says that if any man be caught in a trespass, meaning in a shortcoming, anybody makes a mistake or even a sin, right? You who are spiritual, should restore such a person in faith, considering yourself, lest you also be tempted, meaning lest you also make the same mistake. We need to be real careful. I'm real careful in my walk today about judgmentalness, about why is this person in this condition, and that goes back to that affliction quote that I gave you early on. So mentorship, showing them something different, meeting them where they're at, and then committing ourselves to working with them. A lot of folks say we have problems in Memphis with youth, but I see few people actively involved
stepping up and working with them.
Yeah, absolutely. Absolutely. Very, very important. Interesting thing, we have a fantastic preacher at New Salem Missionary Baptist Church, Dr. Alex Glenn, who's been charged with our youth. He's done wonders with working with the youth in our church. So he's an excellent role model for the youth that he's working with. But my concern, which I've been devoted to for the whole time I've been in Memphis, has been working with troubled youth, at-risk youth, justice-involved youth. It's the least of these.
Yes, I love it. I love it. Okay. Yeah. I like to end the show with a few personal questions so people can really get to know Thurston. And we're probably going to run out of time, so my producers are going to
That means you're going to bring me back?
Yeah, I'm going to have to bring you back. But quick question, what's your favorite movie?
Every Denzel Washington movie there.
It's my guy right here.
Equalizer 3.
Oh, I like all of the Equalizers. I love it.
Equalizer 3. That's my man. Or Training Day. You want to go home or you want to go to jail?
No, that's one of my least favorite because I don't like him being like that.
Playing a gangster. But he did that well.
He did that in American Gangster.
Oh, yeah.
Oh, my God. He was so good.
Playing Frank Lucas.
Yes. He was New York.
Harlem.
Okay. What's your favorite song?
Matter of fact, Sean Puff Diddy's daddy was his driver.
Really?
Oh, correct. Yeah.
In real life?
Sean P. Diddy's daddy was Frank Lucas's driver, and he was killed when Puff Daddy was 3 years old. Not to change the conversation.
No, but still, I mean, that's facts. So
yeah, absolutely.
Like for our viewers to know what's going on, that's something.
Yeah, absolutely.
What's your favorite song?
Wow, I don't know.
You don't know? Okay.
You really caught me.
Favorite food?
Well, wait a minute. Hey, Joy and Pain, Frankie Beverly.
Okay. Oh,
yeah.
the late.
What am I talking about? Beverly. Yeah. Yeah.
Joy and Pain. Favorite food?
Joy and Pain. Fried chicken.
Okay. Thurston, if somebody wants to get in touch with you, maybe have you come speak to their group, their organization, how do they reach you?
All right. Let's shoot. Email address is T as in Tom, E as in Edward, E as in Edward Smith, TEE Smith, 1 at hotmail.com. Is it safe to give my cell out?
You don't want to do that. Just call the office, and I will connect you with him.
Okay.
901-278-0881, because there's no telling who might call you on
Good
your
advice.
cell.
Thank you so much.
You're welcome. Thank you so
This
much
was
for coming on.
Thank you for
10 years later.
10 years.
It can't be 10 years, another 10 years, so you got to come back sooner than that.
No, ma'am. Thank you so much.
All right. Thank you. And thank you for watching Dialogue with Deidre. We'll see you next Friday.